Hello, my name is Katherine Brown, and I'm a student in Kent State's Cardiodynamics Lab, where the name of the game is pain. Now, I know that sounds bad. You're thinking, please don't give them funding for the study. But what I'm going to talk to you about today is how we plan to investigate the effects of CBD supplementation on pain and a host of cardiovascular variables. Previous research has demonstrated that acute supplementation of CBD have reduced pain, heart rate, blood pressure, and that CBD may also reduce stress-related increases in heart rate and blood pressure. Changes in vascular function are suggested to play an important role in these adaptations. With this being said, we seek to evaluate acute and 10-day chronic CBD supplementation, or placebo, at 600 milligrams per day on cardiovascular responses at rest, 45 minutes after acute administration, and before, during, and after our stressor, the CPT, in young healthy adults. This will be a counterbalanced, double-blind, placebo-controlled, crossover design study. We will recruit 20 healthy subjects, and upon entering the lab, subjects will undergo 10 minutes of supine rest, where cardiovascular variables will be stabilized. Subjects will then undergo an additional 5 minutes of rest that will yield acute resting data on heart rate, blood pressure, vagal tone, and baroreflex sensitivity. These are our baseline values. Subjects will then be administered 600 milligrams of CBD or placebo, followed by a 1-hour absorption period. These same variables will be collected 2 minutes before the CPT administration, 2 minutes during, and 2 minutes after the CPT. This same protocol will be utilized on day 1 as well as day 10 for both acute and chronic CBD supplementation measures. Vagal tone will be measured using heart rate variability and heart rate complexity. On the left, we have heart rate variability. This allows us to establish high frequency or parasympathetic activity and low frequency or sympathetic activity. This will give us an indication of the ratio or balance between autonomic nervous systems in an individual. Now let's talk about heart rate complexity on the right and what that means for vagal tone. Parasympathetic activity is mediated by acetylcholine, or ACH. ACH is secreted by the vagus nerve. This essentially makes parasympathetic activity synonymous with vagal tone. So an increase in parasympathetic activity means an increase in complexity and an increase in vagal tone. So looking at the picture, if Old MacDonald had a dot, parasympathetic activity would have a dot dot here, dot dot there, here dot there dot, everywhere dot dot. Whereas in contrast, sympathetic activity has less complexity, less tone, and less variability, as indicated on the picture here. Notice how everything is really concentrated to this one area. Finger photoplethysmography with a phenometer will be used to collect continuous blood pressure. Heart rate and blood pressure will be used to calculate baroreflex sensitivity with the sequence technique. The baroreflex is a negative feedback control system that monitors changes in blood pressure through receptors that are located in your carotid sinus and aortic arch. These changes are relayed back to the brain, which then modulate heart rate and peripheral vasoconstriction flow. We hypothesize that in comparison to the placebo, both acute and chronic CBD supplementation will reduce pain during the CPT, have no effect on vagal tone at any point in time, and will reduce heart rate and blood pressure at rest and during the CPT. While these results are good and dandy, we are most interested in results from chronic supplementation during the CPT, so these values outlined in red. We expect these results to be significantly different from rest intervals 1 and 2, as well as its acute counterpart. We also expect chronic results during the CPT to be different from before the CPT administration. Projected limitations include an overall lack of data on CBD dosages, even at low levels, as well as side effects associated with CBD supplementation. Other concerns include purity, as CBD is not regulated by the FDA, and interaction effects between CBD and diet, as well as CBD and physical activity. Despite these limitations, we expect that CBD will be safe and effective, and that it will have positive effects on cardiovascular responses, both acutely and chronically at rest, and in response to the CPT-related stress when compared to a placebo. Future research should work to evaluate the effects of CBD on pain, examine the effects of CBD on cardiovascular function, and discover the effects of CBD when used in combination with cannabis. Thank you for listening. What questions do you have for me?